So the next question I have for the team is, when we develop an osteosarcoma treatment plan with the client and specifically for the patient, what do primary care veterinarians and oncologists commonly consider? And what we really mean here is quality of life considerations, treatment considerations, financial considerations, and toxicity and things like that. Dr. Jeglum, do you want to go first?
I think all of those points are very valid. I mean, I think cost, at least, again, somewhat geographically dependent, but I think cost has to be a very big determining factor in today's time. And I agree that carboplatin is certainly affordable and reasonable as far as scheduling and all. Prognosis is very important. And I don't know how realistic we can be in really saying what we do with the amputation and chemo. I don't think the results have changed in the last 40 years. When we started amputating in the 70s with chemo, that was doxorubicin in those days, and we moved on to carboplatin. None of the literature has really changed significantly in my perspective. Quality of life is absolutely, essential. So toxicity, which yields into the quality of life, is critical. But I think quality of life and financial are huge. Have to figure into any approach.
Other team members want to jump in?
I think another big thing is comorbidities that the patient has. If it's an older, large breed dog, many of them will still get around really well on 3 legs, but, is it a dog that we want to put through that big surgery? Can it metabolize chemotherapy well? Is it truly a good candidate for standard of care, or should we focus on something like palliative radiation instead, or pain medications for that patient?
I agree with Dr. Foskett. I think we're all probably used to the amputation conversation being the rate limiting step of our management of this disease, right? That's probably, maybe I'm projecting, but that's where our practice tends to have to put the most effort. It's not actually the chemotherapy concerns I found, but it's my dog can't tolerate 3 legs, and no matter what our orthopedic and neuro exams would agree, and whether that's further confirmed by their primary veterinarian before they come to see us. I think that's the biggest challenge, or the biggest hurdle to get our clients over, is that these dogs actually, in my opinion, have an improved quality of life after we've removed that tumor.
And can the team speak to some of the difficulties? Because when I think about putting myself into the client's shoes, we all talk about medians, but we all are the first to recognize our patient's never going to be the median. And, I think that's one of the hardest parts for me is as Dr. Jeglum pointed out, I don't know that we've dramatically changed outcomes when it comes to this disease for a very, very long time. And obviously one of the reasons why we're here today is to talk about some things that's going to try to move that forward in a very exciting fashion. But how do you approach that discussion with clients as to, yes, these are the medians, but do you openly talk about ranges and percentages as to when we then see maybe 2-year, 3-year, 5-year type of outcomes? How do you guys approach that?
I think we've worsened the median because our science has gotten better. So we now really know what we're doing. It's not quite so aspirational. But I'll tell you, I train my residents to focus less on numbers, because we don't know most of the time. And the problem is, if you scare someone with a number that sounds low to them, and that dog could have been one of the 3-year osteosarcoma dogs, that's a bummer that they missed out on that. And so I will acknowledge that things cannot be good. And so I tend to focus on what the benefit of each piece is. And I use the Colorado State life and limb discussion that, limb is about pain, life is about controlling metastasis. And I tell them that we can definitely take the dog out of pain, but in the metastasis, we tend to do 2 to 3 times better on average if we add chemotherapy compared to not adding chemotherapy to amputation. And then I do discuss ranges. They'll ask me, what's the longest you've ever had live? What's the shortest? And I tell them, cancer can take them quickly sometimes, and it's horrible when it does, but we also have dogs that do very well. And then I focus on quality of life, that our whole goal is to maintain quality of life while doing the best we can to extend life. And I try not to get focused on numbers. It's interesting how often clients fixate on those, and that can make or break their interpretation of how the patient cannot have a sick day in its life until suddenly it wakes up paralyzed one morning and has to be euthanized. But it only went 9 months, not the 10 months I talked about, and then it was all a waste of time. Well, if you focus on the quality, I get less sense that it was a waste of time.
think there are always going to be people that are not going to go for amputation no matter what, whatever the outcome, whatever the median is, the mean or whatever. And I find more and more clients who are more inclined to go towards palliative radiation for that very reason. And we have a large population of dogs that never get amputated because of that, or ultimately they might, but at least their initial choice of treatment is palliative radiation.
It's so interesting to me, Ann, because I feel like it's the opposite. I feel like, and I blame social media for a lot of stuff in my life, but I give it credit in this conversation because I found clients are now have these online support groups like, right, bone cancer dogs and tripods, right, and YouTube availability. When we YouTube three-legged dogs, the amount of videos that are available to them, that makes them get over that hurdle a lot more effectively than it was 10 or 15 years ago, in my opinion.
Some of it may be case selection that occurs before they ever get to us.
Fair.
You know, maybe our referring veterinarians are not pro amputation before they ever get to us, and then we have to sell them, you know, the package that amputation is the better way, as far as you're saying, Jeff, for long-term, you know, life versus limb. But, you know, we see a large population that come in and no matter what you do to convince them, they're not going to go with amputation.
Yeah, that selection bias is remarkable how important that can be. And I'm with Zach, you know, in our area, at least, we tend to, I think social media has definitely helped us in that regard, and the ability for a client to see so many dogs on YouTube that are really incredibly functional with an amputation.